Early precut sphincterotomy for difficult biliary access to reduce post-ERCP pancreatitis, a randomized trial. Introduction. Endoscopic cannulation of the common bile duct, CBD, is essential for the success of endoscopic retrograde cholangiopancreatography, ERCP, and when it fails, 5% to 15% of cases, the trauma to the papilla resulting from repeated cannulation attempts raises the risk of complications, especially of post-ERCP pancreatitis, PEP. Precut sphincterotomy is usually employed to facilitate access to the CBD in difficult cases. Most studies have identified precut and multiple cannulation attempts as two independent procedure-related risk factors for PEP. However, because precut is usually done after the failure of repeated cannulation attempts, it is difficult to establish whether it is truly a risk factor for this complication. To assess whether the risk of PEP depends on the timing of precut, some studies have compared the effects of early precut with those of prolonged cannulation attempts. In a retrospective study, the authors examined 1,878 patients with bile duct stone disease. In the subgroup of high-risk patients, the PEP rate was significantly lower when precut was done before than after 10 cannulation attempts. The cannulation and complication rates of early precut and prolonged cannulation attempts have been assessed in some meta-analyses, although these, unfortunately, were limited by heterogeneity in the design and methods. These meta-analyses concluded that there was no significant difference in the CBD cannulation success rates of the two groups, and that results of overall complications, particularly PEP rates, were conflicting. A significant reduction in the risk of pancreatitis among patients receiving early precut versus the standard technique was observed when the analysis was restricted to fully qualified biliary endoscopists, not fellows. Nevertheless, results from these meta-analyses indicate that there is a need for further studies in this area. The primary aim of this prospective, randomized, multicenter Italian trial was to establish whether an early precut strategy in cases of difficult biliary cannulation could reduce the incidence of PEP compared with a strategy of prolonged cannulation attempts followed by delayed precut in cases of failure. Secondary aims were to compare the success of biliary cannulation and complication rates of the two techniques. Background and study aim. Precut sphincterotomy is a technique usually employed for difficult biliary cannulation during endoscopic retrograde cholangiopancreatography, ERCP, for the treatment of bile duct disease. It is a validated risk factor for post-ERCP pancreatitis, PEP, but it is not clear whether the risk is related to the technique itself or to the repeated biliary cannulation attempts preceding it. The primary aim of the study was to assess the incidence of PEP in early precut compared with the standard technique in patients with difficult biliary cannulation. Secondary aims were to compare complications and cannulation success. Patients and methods. In this prospective, multicenter, randomized clinical trial, patients who were referred for therapeutic biliary ERCP and difficult biliary cannulation were randomized to early precut, Group A, or repeated papillary cannulation attempts followed in cases of failure by late precut, Group B. PEP was defined as the onset of upper abdominal pain associated with an elevation in serum pancreatic enzymes of at least 3 times the normal level at more than 24 hours after the procedure. No rectal indomethacin or diclofenac was used for prevention of PEP. Results. A total of 375 patients were enrolled. PEP developed in 10 of the 185 patients, 5.4%, in Group A, and 23 of the 190, 12.1%, in Group B. The incidence of PEP was significantly lower in the early precut group, 10 of 185, 5.4%, than in the delayed precut subgroup, 19 of 135, 14.1%. There were no differences in biliary cannulation success rates, bleeding, perforation, and cholangitis. Conclusions. In patients with difficult biliary cannulation, early precut is an effective technique and can significantly reduce the incidence of PEP. Repeated biliary cannulation attempts are a real risk factor for this complication.